So Jim, how did the visualization work for the needle stick?
It worked pretty well. Worked pretty well with the needle.
Okay.
I'm still anxious, but the needle went well.
Okay, so you were able to do the needle stick, the visualization worked, but you're noticing that you're still really anxious?
Yeah.
Okay. Would you like me to teach you another sort of relaxation technique that you could use at any time that would kind of help you kind of lower your overall anxiety level?
Yeah, I'd be up for that.
Okay. I've found with different patients that actually kind of helping them learn how to breathe properly can actually be very relaxing. So why don't we kind of teach you how to breathe properly?
You may have to learn how to breathe?
Well, not really. I mean, clearly you know how to breathe. But I'm wondering if I taught you this relaxation exercise and you could use it kind of multiple times during the day just to take a couple-minute break and kind of do some deep breathing, if that might help lower your overall anxiety level. Why don't we try it and sort of see how it goes? Is that all right?
Why not?
Okay. So why don't we practice it right now? Are you kind of in a relaxed position right now?
Yeah.
Okay.
I'm okay.
So why don't you take your right or left hand, I don't know if you're right or left-handed.
Righty.
Okay, so take your right hand and put your thumb just sort of on your belly button. Okay, because what we're going to try and do is we're going to try and breathe through our belly. Most people breathe through their chest, and they especially do that when they get anxious. So the chest kind of go up and down like that, and then the oxygen doesn't kind of get into their system. So what we're trying to do is to get the maximum amount of oxygen into your system, which will help kind of relax you. Okay? So let's put our hand there. And if you want, you can close your eyes. I find it helpful to just, kind of take a couple minutes. And what I want you to do is basically breathe. And what we're trying to do is to have your right hand kind of move up with your belly. You kind of want your belly to move, to kind of blow out almost like a balloon. Imagine there's kind of a balloon and it's kind of going out and coming back in and contracting and constricting, okay? So if you notice that your hand is moving up and down, then you're doing it the right way. And usually what I do is I do about 15 breaths like this, and I find that that's very relaxing.
Kind of boring, though.
Yeah, it's kind of boring. You know what? If you find that you get bored with deep breathing like this, what you could do is incorporate like a visualization element. So some people like to visualize colors, like visualize a color on the inhale and a different color on the exhale. Like some people inhale blue and exhale pink. Is there a color that is relaxing to you?
Not pink.
Okay. What would be a nice color to inhale? Like that would represent like peace or,
I like kind of like a bluish gray. How about that?
Okay, so what if we inhale kind of bluish gray? And what would you like to exhale? What color don't you like?
Well, don't like pink, so why don't I exhale pink?
Okay. So inhale bluish gray, exhale pink. And literally imagine your sort of body kind of filling up with the bluish gray air and exhaling sort of the pink air. Inhaling, exhaling. Some people also find words or concepts are helpful, like they're inhaling peace and they're exhaling sort of hatred, or they're inhaling love and they're exhaling anger. And I think the reason it works is because it forces you to concentrate a little bit more. You know, when you're inhaling the colors, you sort of visually imagine the one color coming in and the other color coming out. How are you feeling with that? You still doing the colors?
Yeah, I'm still doing the colors.
Okay. What are you noticing?
It's pretty relaxing. It's pretty relaxing.
Okay. So why don't you open your eyes and then what'd you think?
Well, it helped. It helped.
Okay. Did you like the colors?
The colors work.
Okay.
The colors work for me.
Colors work better than the words like love or peace or, yeah?
Yeah.
Okay.
Yeah.
Okay. So what if you were to do that like a couple times a day in a structured way? Like the times that you notice that you're most anxious, literally take like 2 or 3 minutes and go do that breathing exercise with the color and the deep breathing. How would that, just to kind of lower your overall anxiety level?
That shouldn't be a problem.
Okay. And one thing I often tell people to do is to lie down on the ground and to breathe and to put their stomach on their hand. Because when you're lying on the ground, you can really get the sensation of breathing through your diaphragm. For some reason, it's a little easier on the floor. So you could try that.
Okay.
Okay?
Okay. Thank you.
All right. So why don't you try that? And if it doesn't work, we'll try something else, okay?
Okay.
And by the way, I'll give you, I think you have that patient handbook still. There's a section in there on visualization incorporating, into deep breathing. You can read through that.
Okay. Thanks a lot.